check accuracy of medication administration record by comparing it with doctors' written orders. Everything checks out right. Everything looks good. Okay, so I compared it and everything looks good. Next, check for allergies, contraindications, potential drug or drug food interactions. What else? Check appropriateness of medication for patient. Appropriateness, yeah, medication will give it. Everything looks good. Yeah, I don't see no reason why I can't give the medication to the patient. So everything looks good. Okay, next, review assessment and laboratory data that may influence drug administration. For example, respiratory rate for opioids, and food and blood pressure for antihypertensive medication. Check. No, everything looks good. I believe it won't interact with any of the conditions of the patient. Everything looks well. Next, I'm gonna prepare medication. First, I'm gonna perform hand hygiene. Wash my hands. I'm gonna wear gloves. When I prepare the medication, one patient at a time, so I won't get things confused, or mixed up. So I'm gonna pull out the medication drawer, matching names on drawer to MAR, and the medications. Take them all out. Okay. Next is I'm gonna read MAR to select correct medication. From the drawer, observing the 7 rights. The 7 rights are right drug, right route, right time, right patient, right medication, check for expiration, and write documentation. Okay, I'm gonna perform a calculation to determine the correct amount of medication. So the patient, the doctor gave me a vial of 2.5 ml. He told me to give him 1/5 of it. So if I do the math, it comes down to 0.5 milliliters. So I gotta give the patient 0.5 milliliters. Okay. Select the okay. So for the appropriate, I'm gonna use the 1 ml, 1 cc syringe with a 1-inch needle. What else? Okay, so now I'm gonna have to draw the correct amount of medication. First I have to clean the top of the vial. Okay. Next, I have to I'll remove the make sure I put the medication inside the needle, inside the syringe. I'm sorry. Make sure there's a window so I can see. Okay. Okay. Make sure we remove the bubbles. Okay, everything's good. Next, I'm gonna handle equipment without contaminating the plunger. I don't need to change the needle because it's a one-time use. So I'll just make sure to the scoop, close it, and we're done. We check a calculation of medication again with MAR. Everything looks good. Yeah, everything looks good. Next, now I have to make sure I write down the name of the syringe. So the medication, sorry, so I won't get confused. So 0.5 ml Fluzone quadrivalent. Put it on the syringe. Okay, it's ready. So next I have to go talk to the patient. Take my MAR and the syringe and alcohol prep pad to clean the site. So let's go over there. So first we do IPI. Hi, my name is Alana. I'll be your student nurse today. Let me close the door for privacy. Let me remove these gloves and change them for another one. What's your name? Your first name, last name, date of birth. Okay, let me check. Okay, everything matches. Let me finish putting on my gloves. Okay. Let me check your wrist. Can I check your wristband? Thank you. Okay. Okay, your name, your last name, and birthday match correctly. Thank you so much. Now I'm gonna the medication. The medication I'm gonna give you is for it's called Fluzone quadrivalent. It's for the seasonal flu. So your body will have immunity. Well, not immunity, but at least it'll be able to protect you from getting really sick, and you might feel afterwards. You might feel joint pain, low grade fever, minor headache. Those are the symptoms that usually happen, but most of the patients don't get any symptoms at all. Okay, so I'm gonna get the alcohol wipe. I'm gonna clean the area. Okay. The area of the vaccine, it's 3 fingers below the acromion process, which is the bone in the shoulder. There's like where I'm gonna inject you is called the deltoid muscle. There's like an imaginary triangle where I'm gonna inject you right in the middle of the deltoid muscle. Okay, here it goes. Thank you so much. We'll get the syringe and dispose of it without capping it. Um, Next, let me change my gloves. These gloves are wet. The angle of the needle was at 90 degrees, and it's a intramuscular injection. Sorry. Okay, there wasn't no need to aspirate because there's no large veins in that area, and there was no need to massage as it was just an intramuscular injection, nothing else. Okay, so I'm gonna lay you down, pull up the rails, make you comfortable. Is there anything I can do? Anything else I can do for you? No, everything's good. Do you need a blanket? Do you need anything else? Cup of water or something? No? Okay. Let me dispose of the trash. You throw the trash away. Here, trash. This trash. This trash. I'm gonna document the medication that I just gave you. Okay. And other than that, I want to thank you for everything. You've been awesome. Thank you so much. If you need anything, press the buzzer and I'll come as soon as possible. If you have any discomfort, let me know and I'll call the doctor and give him some medication, ask him for some medication or anything that you might need, okay? Okay, thank you so much. That's it.